Hello everyone, in this video today we are going to discuss the base of the skull. Now this specimen of the base of the skull is created by horizontally sawing through an intact skull and removing the calvaria, that is the top of the base of the top of the skull. And now as you can see, this base of the skull can be viewed from the superior side or the top side, and it can be viewed from the bottom side. So this is the superior view of the base of the skull. The inferior view of the base of the skull or the bottom side view is also called norma basalis. So this is the superior view of the base of the skull, and this base of the skull is studied by dividing it into three segments: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. They are actually arranged in the form of three steps. The anterior cranial fossa is the highest level, the middle cranial fossa is slightly below this, and the posterior cranial fossa is still below the middle cranial fossa. Now one by one we will go into the details of these segments. First let us take up the anterior cranial fossa. This anterior cranial fossa is formed by this thing. This is the orbital plate of the frontal bone, and this is the squamous part of the frontal bone which has been cut through. So anteriorly you have the frontal bone, partly the squamous part and partly these two orbital plates, and in between these orbital plates you had the gap which is filled in by this small structure. This is the cribriform plate of the ethmoid bone. So between the orbital plates of the frontal bone, this gap is filled in by the cribriform plate of the ethmoid. So these small perforated structures that you can see, this is what makes the plate cribriform. That is, this is the structure responsible for forming the sieve. And on the cribriform plate of the ethmoid in the middle, you can see this elevation. This midline elevation is called the Crista Galli or the cock's comb. So you have the orbital plates of the frontal bone here, and in between, in the cleft between the orbital plates, you have the cribriform plate of the ethmoid, and still behind this structure over here is the lesser wing of the sphenoid. So this is the lesser wing in the anterior cranial fossa, and these are the greater wings in the middle cranial fossa. So these two lesser wings and this pointy projection from the lesser wing, that is the anterior clinoid processes, one here and one here. So the posterior margin of the lesser wing of the sphenoid is the limit between the anterior and the middle cranial fossa. So on the sides you have the posterior borders of the lesser wings, then coming medially you have the anterior clinoid processes, and bridging in between, when you come on to the body of the sphenoid, you have what we call the jugum sphenoidale. This plain high elevated patch of bone over here is the jugum sphenoidale. So the lesser wing of the sphenoid, anterior clinoid process, and the jugum sphenoidale, these complete the demarcation between the anterior and the middle cranial fossa. Now let us go into some amount of detailing in a different view. So in this view here, this enlarged view of the anterior cranial fossa, and again here you can see the orbital plates of the frontal bones over here. This is the cutout squamous part of the frontal bone, and this perforated patch over here, this is the cribriform plate of the ethmoid. This flat plane over here is the jugum sphenoidale, and these pointed structures, these are the anterior clinoid processes, and this sharp margin over here is the posterior margin of the lesser wings of the sphenoid. Now if we go into some details, see over here in the middle you have the frontal crest. This is the frontal crest coming down from the squamous part of the frontal bone. So this is the frontal crest, and just behind the frontal crest you can make out there is a small opening over here. You can see this small opening, and this small opening is actually the foramen cecum. So just behind the frontal crest over here you have a small opening. This is the foramen cecum. This communicates with the roof of the nose, and over here through the foramen cecum you have passage of a small vein connecting the superior sagittal sinus to the veins in the roof of the nose. Now this frontal crest gives attachment to the falx cerebri. This falx cerebri is one of the dura mater, the folds of the dura mater, folds of the meningeal layer of the dura mater. So we have not yet studied the intracranial meningeal folds, but one of the most important of the intracranial meningeal folds is the falx cerebri, and the falx cerebri is attached to this frontal crest anteriorly. It is quite a large structure, crescent shaped, going across the top of the, but the anterior sharp end is attached over here to the frontal crest, and this foramen cecum is located just beyond the ending of the falx cerebri. So you have the frontal crest with the attachment of the falx cerebri, and to the base of the falx cerebri the two layers diverged, and just towards the attached margin of the falx cerebri you have the superior sagittal sinus, as if the falx cerebri is attached somewhat like this, and in the middle you have the superior sagittal sinus on its attached margin posteriorly. So frontal crest, foramen cecum, attachment of the falx cerebri, and the lodgement of the superior sagittal sinus. Now if you come beyond that to this perforated patch over here, the cribriform plate of the ethmoid. Cribriform means it's perforated, and in the central part you have this elevation, the coxcomb or the Crista Galli. So this falx cerebri coming down is also partially attached to the Crista Galli of the ethmoid. Now these perforations on this side, the perforations over the cribriform plate of the ethmoid, they give passage to filaments of the olfactory nerve. So olfactory nerve filaments are rising up through this passage over here. If we draw them, so you have olfactory nerve filaments rising up through these small perforations. So these are all olfactory nerve filaments, and these filaments, when they come up, they are bundled up into what we call the olfactory bulb. So over here you have a bulbous structure which is called the olfactory bulb, and these olfactory filaments are all going into this olfactory bulb over here, and this olfactory bulb lies over the jugum sphenoidal. Not only that, you can make out that a part of the brain was lodged here on the orbital surface of the, on the superior surface of the orbital plate of the frontal bone. You can make out these impressions of the sulci and impressions of the gyri rather. If we try to draw them, then these impressions, see, this is one, this is one, the impressions of the gyri of the inferior surface of the frontal lobe of the brain. These are the impressions of the gyri. So the frontal lobe of the brain would be lodged over here, and the frontal pole of the brain is somewhere here. So this is the frontal pole of the brain, and you have the frontal lobe of the brain. And not only that, the gyrus of the undersurface of the frontal lobe, that is very close to the midline, is the gyrus rectus, and the olfactory bulb is actually below and slightly outside the gyrus rectus. So over here you have the lodgement of the gyrus rectus as well as the olfactory bulb. Now this gyrus rectus and olfactory bulb then are coming over onto the jugum sphenoidal, and this orbital plate of the frontal bone lodges the frontal pole of the brain, and the inferior surface of the frontal lobe, which is also called the orbital surface of the frontal lobe, that is lodged over here. And through these openings in the cribriform plate you have the filaments of the olfactory nerves coming up and getting embedded in or being continuous with the olfactory bulbs over here. So olfactory bulb, gyrus rectus, olfactory filaments. Now some other important structures. Apart from the structures that we have been drawing over here, these holes are not all just for the olfactory bulbs, the olfactory filaments and the olfactory bulb. Apart from these, you have some other structures. Now over here you have the roof of the orbit, and over here you have the roof of the nose. So at the junction between them, somewhere here and somewhere here, you have the opening of the anterior and posterior ethmoidal canals.